How often should you use a vacuum pump for erectile dysfunction? Is it something you use every day or only when you want to have sex, a few times a week? And what if you're using it for penile rehabilitation after prostate cancer treatment? This is one of the most common questions we get at Restorative Health Clinic. And the answer is, it depends on why you're using it. Because using a penis pump for sex is not always the same as using a penis pump for penile rehabilitation. So in this video, I'm going to explain how often men may use a penis pump and what the difference is between using it for intercourse and rehab, and how long a session should take and the safety rules you need to know. I'm Melissa Hadley Barrett from Restorative Health Clinic, and we help men every day with erectile dysfunction, prostate cancer recovery, penile rehabilitation, Peyronie's disease and men's sexual health concerns. Before we start, this video is for general education only. Always follow the advice of your treating clinician. This is especially important if you've recently had prostate cancer surgery, radiation therapy, pelvic surgery, penile surgery, or if you're on blood thinners or have a bleeding condition. Now let's start with the basics. A penis pump is also called a vacuum erection device or a VED. It works by creating suction around the penis. That suction draws the blood into the erectile tissue, and as the blood enters the penis becomes firmer. If you are using the device for intercourse, you may then also use a constriction ring at the base of the penis to help keep the erection firm enough for sexual activity. So the pump helps bring the blood in and the ring keeps it there. That's the basic principle. But the frequency of use depends on the goal. There are two main reasons men use a penis pump. Number one, to create an erection for sexual activity, and number two, as part of a penile rehabilitation program. Let's talk about them separately. First, using a penis pump for intercourse. If your main goal is to get an erection for sex, then you usually use the pump when you want to have sex. So for some men, it might be once a week, for some twice a week, for some more often. There is no magic number that applies to every person. The aim is not to use it as often as possible. The aim is to use it safely and effectively when you need it and you feel like it. For intercourse use, the session usually involves applying a lubricant, placing the cylinder over the penis, creating the suction slowly, and then when the penis is firm enough, you slide the constriction ring onto the base of the penis, release the vacuum and remove the cylinder. The ring stays on during sexual activity. But this is the key safety rule. Do not leave a ring on for more than 30 minutes. This is really important, as leaving it on too long can reduce blood flow and may damage the penile tissue. So set a timer, don't fall asleep until it's removed. Also, do not use a constriction ring if you are intoxicated, very tired or forgetful. A common question I get asked is how long should it take to pump it up? It shouldn't be rushed. Some men can create an erection in a couple of minutes. For others, it may take longer. A good general approach is to have pump slowly over several minutes. Pump a little, pause. Let the penis respond. Pump a little more, pause again. You are not trying to pump as hard and fast as possible. More suction does not lead to a better erection. Too much or too fast suction can cause bruising, pain, swelling. So when using it, think slow, controlled and comfortable, not aggressive. If it hurts, stop. If the scrotum is being pulled into the cylinder, stop and adjust. If the penis becomes numb, painful, very cold or very dark, stop. And if it doesn't return to normal in a few minutes, seek advice. And if you're still looking for a medical grade device that comes with the correct, safe ring sizes, you can find our clinically selected options in our online shop linked below. Now, let's talk about using a penis pump for penile rehabilitation. This is different. Penile rehabilitation is usually about encouraging blood flow, maintaining tissue stretch and supporting penile tissue health, and trying to preserve the length and elasticity while the nerves and blood flow recover. This is especially common after prostate cancer treatment. It is also relevant after bladder cancer treatment, radiation therapy, pelvic surgery, or for a long period of poor erections. When erections stop happening naturally, the penis may not get the same regular blood flow and stretch that it used to get. So over time, some men notice penile shortening, reduced elasticity, or changes in the erection quality. So penile rehabilitation is not always about having sex right now. It's often about keeping the tissue as healthy and as responsive as possible while recovery is happening. So how often should you use a penis pump for rehabilitation? Some research protocols mentioned in the literature have used examples such as 5 minutes twice a day for a period of weeks, 5 minutes every other day after surgery, or 10 to 15 minutes daily before penile implant surgery, for example. But that does not mean every man should copy those routines. Your ideal frequency depends on your surgery, your healing stage, your pain levels, your erectile function, your device, and your goals, and whatever else is in your rehab plan. The research in this area, to be honest, is inconsistent and not thorough. At Restorative Health Clinic, we use what happens in nature as our guide and individualise the treatment regime on the issue the man presents with. Because a man 6 weeks after prostate surgery is not the same as a man 2 years after surgery. A man with Peyronie's disease is not the same as a man with mild erectile dysfunction. So for penile rehabilitation only, many men use the pump without a constriction ring. That is really important. The ring is only required when the goal is intercourse because it traps the blood into the penis. For rehab only use, we want the blood to come into the penis and then drain out again, just like you would if you were doing weights with your arm. So the process is more like a gentle exercise cycle. Pump it up slowly to 50 to 60% until it's engorged or full. Hold it in the tube in this state for 1 minute and then release and repeat this process 3 times. This should only take 5 to 10 minutes in total. Preferably you'll do this daily as healthy penis has 3 to 5 erections whilst the penis owner is asleep. The goal is for comfortable fullness and stretch, but not pain, not maximum suction, and not forcing the biggest possible erection. Think of it like physiotherapy for your penis. It should be controlled, consistent, and safe, not aggressive. The most important thing is consistency. So for rehabilitation, gentle and regular use is the way to go rather than occasional aggressive use. Do not try to make up for missed sessions by overdoing it. If you miss a day, you miss a day. Just return to the plan. Now let's talk about a very common mistake. Men often ask, if using it is good, should I use it for longer? Not necessarily. Longer is not always better. More pressure is not always better. More often is not always better. The penis is delicate tissue and too much suction or too much time can cause bruising, pain, numbness, swelling, skin irritation, or even injury. The goal is to use the device in a way that supports your sexual function or rehabilitation without causing harm. If you are using the pump for erectile dysfunction and intercourse, you may not need to use it every day. You may only need to use it when you want to have an erection for sex. But some men also use it regularly for confidence and practice. This can be helpful because there is a learning curve. The first time you use a pump, it can feel awkward. The second time may be better. The third time may be better again. There's a clear learning curve here, and it takes time to figure everything out. You'll need to experiment with the right amount of lubricant, find the correct ring size, and learn how to keep the scrotum from being pulled in, and simply get used to how a VED erection feels. That is normal. So in the beginning, even if you're not having sex, you may practice using the device so that it's easier and less stressful when you do want to use it sexually. But again, practice gently and don't overdo it. Now, let's talk about how often is too often. It may be too often if you notice persistent bruising, soreness, numbness, or skin irritation. It's also a red flag if you find yourself using stronger and stronger suction just to get the same result. Or if you're pumping repeatedly out of anxiety, just to check that everything still works. That constant testing can become incredibly stressful. To keep it simple, here's what you should and shouldn't feel. During a safe session, it's completely normal to feel a gentle pulling, fullness, pressure, or penis expanding. But you should never feel sharp pain, severe pinching, or intense skin pulling. If that happens, release the vacuum immediately, use more lubricant, and take a break. That last point is incredibly important. When dealing with erectile dysfunction, it's easy to become hyper-focused on testing yourself. Men often end up checking constantly, pumping repeatedly, and looking for reassurance, which only adds more stress to the situation. If that sounds like you, please know you are not alone. But remember, the goal of treatment isn't constant testing. It's about long-term recovery, confidence, and quality of life. Getting a structured plan from a clinician can make a massive difference in lowering the anxiety. Part of that plan is knowing exactly what to expect during a session. Ideally, you should only feel a gentle pulling, fullness, pressure, or the penis expanding. That is completely normal. What you should never tolerate is, as I said previously, the pain, the pinching, the skin pulling or numbness. And if the pressure ever feels unbearable or your scrotum is getting sucked into the cylinder, stop immediately and use the release button. Pain is a warning sign, not a sign of progress. If that happens, release the vacuum. Take a break and adjust everything. Now, what about the constriction ring? If you are using the pump for sex, the ring will be needed to maintain the erection. But the ring is often the part that causes the problems. If it's too loose, the erection goes down. If it's too tight, it hurts. The ring should be firm enough to help maintain the erection, but not so tight that it causes pain, numbness, or distress. And again, it shouldn't stay on for more than 30 minutes. For penile rehab, you don't need to use the constriction ring. This is one of the big differences between rehab and intercourse use. So what about if you're using a pump with tablets like Viagra or Cialis or Levitra? Some men use the pump alone, some with tablets, some with injections, or a combination. For some men, combining treatments can work better than one option, but you may need to know what is safe for you. For example, some men can't take erection tablets because they're on nitrate medication for chest pain. Some men need a medical review because erectile dysfunction can be linked with cardiovascular risk factors, diabetes, high blood pressure, cholesterol, hormone changes, or prostate cancer treatments. So do not think of the pump as the only answer. Think of it as one tool that may sit inside a bigger erectile dysfunction plan. Now, how quickly should you expect results? For intercourse use, the result may be immediate once you've learned how to use the device properly. That means you may be able to create an erection for sex using the pump and ring. But the first attempt may not be perfect. You may need practice. For penile rehabilitation, the results are slower. This is not about one session. It's about repeated, gentle use over time. The benefits may be around tissue health, maintaining length, improving confidence, and supporting recovery. And not every man responds in the same way. So in summary, how often should you use a penis pump for erectile dysfunction? If you're using it for sex, use it when you want to have sex, as long as you use it safely and you don't leave that ring on for more than 30 minutes. If you're using it for practice, you may use it regularly while you're learning how, but keep sessions gentle and short, and stop if there is pain or bruising. If you're using it for penile rehabilitation, your clinician will recommend a structured routine, which may be daily or several times a week, depending on your situation. And if you are not sure which category you fall into, please get advice, because the right frequency depends on the reason you're using it. Now, let's go through the common mistakes. Mistake number one is using it too aggressively. A pump should not be a test of pain tolerance. Mistake number two is using it for too long. Longer doesn't mean better. Mistake number three is leaving the ring on too long, never more than 30 minutes. Mistake number four is using the wrong ring size. Too loose, it won't work. Too tight, it'll be unsafe. Mistake number five is not using enough lubricant. A poor seal makes the device frustrating and uncomfortable. Mistake number six is giving up too soon. There is a learning curve. Most men need practice. Mistake number seven is copying someone else's rehab plan. Your plan should match your surgery, your illness, your recovery, your erectile function, and your goals. Mistake number eight is expecting the pump to permanently make your penis bigger. A pump can create temporary fullness, and in some rehab settings, it may preserve length or assist in regaining lost length, but it should not be sold as a guaranteed permanent enlargement device. Now, who should be especially careful with these devices? First, if you're on blood thinners, you might bruise more easily. That's generally okay as it heals quickly, but you do need to be gentle. You should definitely speak with a clinician before using a pump if you have a bleeding disorder, severe Peyronie's disease, or any recent surgeries, wounds, infections, and skin problems. Finally, if you have reduced sensation in the area, take care. Since you can't feel pain or pressure properly, it's much easier to accidentally overdo it. And if you develop significant bruising, swelling, numbness, pain, or skin injury, stop using it and seek medical advice. So, let's summarise. A penis pump can be an effective, tablet-free option for erectile dysfunction, especially for men who can't take medication or for those recovering from prostate cancer treatment as a part of a rehab plan. But remember, the frequency depends on your goal. If you're using it for intercourse, you simply use it whenever you want to have sex. But if you're using it for rehab, you need to stick to a plan. And if you are learning, practice gently and safely. The most important rules are Go slowly, use lubricant, use the correct ring if you need one, do not use too much pressure, do not ignore pain, and do not leave the ring on for more than 30 minutes. And get help if you're not sure. At Restorative Health Clinic, we help men work out whether a penis pump or a vacuum erection device is right for them, how often to use it, how to use it safely, and how it fits into their overall erectile dysfunction or penile rehab plan. We have also clinically selected pumps and erection devices available through our online shop. So, if you already know what you need, you can have a look there. And if you are not sure, book a telehealth appointment with one of our team members today. It's much better to get the right advice than to buy a device, use it incorrectly, and then feel like it's failed. I'll put the links below for the online shop and appointments. I'm Melissa Hadley Barrett from Restorative Health Clinic. Thanks for listening, and remember, you're not alone. Erectile dysfunction is so common and help is available, and you don't have to go it alone. So to find out how to use VED devices available at Restorative Health Clinic, watch the next video.